Welcome to this episode of ECGs Made Simple. Now, if you're just stumbling across this video, make sure you subscribe and check out the other episodes. With that out of the way, let's get started. Here's a new rhythm that we haven't talked about. And really, the rhythm isn't the problem. It's a single beat. And let's look across the strip. Do you notice the beat that looks different? You notice how the QRS complex is about the same shape, but the P wave is different. Why is that? Let me break that one down, but we're going to have to go back to Einthoven's triangle, and then we'll come back to this rhythm. So we know that normally the electricity in the heart moves from the top to the bottom, and it hits that positive electrode and creates a P wave. That odd beat that we were looking at is called a PAC, or premature atrial contraction, and it's when one part of the atrium becomes irritated for a variety of reasons, and it fires off and kind of temporarily, just for a single beat, takes the role of the SA node. So what happens when this fires off is it hits that positive electrode at a different angle, and it gives it a different shape P wave than you would get when it's coming from the SA node. Now, sometimes it's unifocal or just coming from one particular spot, and then other times it's coming from multiple spots. And every time it hits that electrode from a different angle, it's still going to produce a positive upright P wave, and the PRI should be still within normal limits. But the P waves are all going to be shaped differently. But we know it's originating in the atria because we have that P wave. It's before the complex, it's upright, the PRI is normal. So now let's jump back to that rhythm. And we're going to identify the rhythm underneath it, and then we're just going to call it with a PAC. So our rate, we're not going to count that single beat as a rate because as far as we know, it's just one individual beat. Multiplying the numbers like we have been would just give us a false heart rate. So we got 4 regular complexes. We double that for our 6-second strip. That gives us 8. So we got a rate of 80. Now, regularity. Let's check. We're going to skip over that beat, and we're going to see if it's regular aside from that beat. It is regular. The underlying rhythm is regular. That one beat throws it off. So instead of calling it regular, we're going to call it regular irregular. Now, are the P waves present upright? Yes, they're all present. They're all upright, but they're not uniform. So we need to acknowledge that so we can identify this beat. This P wave looks like the rest of them, and it meets all the criteria. So we're just going to say yes, but not uniformed. But what about the other P waves? Well, let's take this P wave, for example. It looks normal, upright. It matches the rest of the P waves with the exception of the one with the PAC. So we're going to go ahead and say the P waves are upright and present. So what we're doing here is we're actually trying to identify the individual rhythm, and then we're going to identify the actual beat. So let's measure that QRS. That looks like it's about 2.5 small blocks. So we'll call that 0.10. PRI, that's 4 blocks again. So 0.16. We'll put that in there. So what we're going to call this, since we have a regular rate of 80 and all the other criteria are within normal limits, is we're going to call it a sinus rhythm with a PAC. So in this rhythm, that's an individual beat, but the same phenomenon can happen and it can actually override the rhythm. And that's it for this episode of ECGs Made Easy. Now to catch our other episodes, go ahead and click right here and I'll see you over there.